Today's social media segment is brought to you by Terrebonne General Health System. Your health is our legacy. Rouse's, you're either local or you're not. Buick, the craft of modern luxury. St. Martin and Bork, know your rights.
Hey everybody, welcome back into Bayou Time. Harry McCullough here. We're going to get to the heart of the matter in this next segment. That's actually, we're going to be talking about heart disease and more specifically vein disease and how it relates to cardiovascular disease. CIS, of course, one of the great institutions around our area, the Cardiovascular Institute of the South. Dr. Ayush Arora is here. Thanks so much for being with us, Ayush. Been here about a year. First of all, you feel good about being at Houma and working here. So
well,
welcome.
Thank you for having me. And this is my second time coming here, so thank you again. Yeah, I've been here for a year now. Moved in July and then have been practicing predominantly in Thibodaux, but also go to Morgan City and do procedures in Gray and Houma.
Yeah, interesting. The topic we're going to talk about today is actually vein disease. And, you know, a lot of people know cardiovascular, heart, and upper respiratory areas, but it's very important for all the way down in your legs when you have veins. So tell me about how that relates to cardiovascular disease.
Okay, so vein disease is a multitude of problems ranging from which can manifest as blood clots to swelling in the legs. And it's more predominant than we think it is. And according to a recent study, more than 24 million people in Americans suffer from vein disease. It's very common in women. It's according to an estimate, around 40% of the women will develop vein disease in their 40s. The main symptoms that patients present with are swelling and pain.
Women, why more so women? Is it because of their type of shoes, or is it just something different between men and women?
Great question. So I'll focus on the insufficiency part or the swelling part. That the pathology is damage to the valves that make sure that the blood flows in one direction towards the heart. And as the valves get damaged, the blood starts to seep back in the opposite direction towards your feet. And then it starts to show up as different signs as swelling or spider veins or varicose veins. And in more advanced form, it can lead to ulcers and infections and even limb loss. So it's more than just a cosmetic problem. And why is it seen more commonly in women? One of the thoughts that is that pregnancies increase the pressure in the pelvic area, and that can lead to vein valve damage, and multiple pregnancies is a risk factor.
So this is not a cosmetic disease, right?
It is not just a cosmetic disease.
It could be though, right?
It could be, certainly. A lot of people want treatment for cosmetic reasons, but it can also lead to limb loss or people losing their limbs because of venous disease ulcers.
Right.
So it is way more than that. And that's just the insufficiency part. I haven't talked to you about clots so far. Vein disease also encompasses clots, which can cause significant morbidity or problems with pain and swelling. In extreme case, also limb loss. And sometimes these clots can travel to the lungs and cause clots in the lung veins, which can be life-threatening as well.
Almost like ASCVD, right? Almost like a stroke or those kind of things with clots as well.
Correct. It's a different pathology. In the arterial system, there's ASCVD, that is the atherosclerosis, and when the plaque ruptures, there's a clot formation. The clot formation in the veins has different pathology, and it is more so related to immobility or hypercoagulable states, meaning prothrombotic, meaning states can lead to more clot formation, such as cancer. Those and immobilization, those are more likely the pathological mechanisms for clots in veins.
How does it present to a physician? Do you know something's coming on? Is it almost like a heart attack or stroke, or is it just something over time where your feet don't feel right? How do they present to you?
Okay, so So the insufficiency part where the valves get damaged, it's a slow progression of swelling, spider veins, and varicose veins. It's a slow progression, and then people know. And it can be managed with just compression stockings. However, when it becomes lifestyle limiting, then we can do office-based procedures that are simple and safe and get and solve the problem. In terms of clot, that's more usually an acute problem. It'd be sudden swelling and pain of the limb, one usually, not both. And if it goes to the lungs, then it can cause more disturbing features such as chest pain, shortness of breath, and even death.
Right. So a lot of times you can treat this right in a clinic, and it doesn't have to be a surgery.
Correct. Every procedure that is done for insufficiency or damaged valves can be done by office-based procedures that do not require any inpatient stay and have very short recovery period, a day, and then so these are pretty safe and can be done in the office and are being routinely done.
I see. So so that'll save in cost and all that when you don't have to do surgeries, I'm
Correct.
sure. So,
The treatment has come a long way from what it used to be. Used to be done surgically in the OR, but now can be done in the office with new techniques.
oh yeah, that's great. It's a lot less invasive. As
Minimally
well, right?
invasive, correct.
So Craig Walker, I know, has been on the cutting edge of this a long time, of course, over there at CAS too. And as you guys follow in, how is this becoming more and more popular as a treatment for patients?
Certainly, it's a highly underdiagnosed problem and less recognized and historically been managed with diuretics. But now we have noticed that if it is diagnosed at the right time, it can prevent a lot of long-term problems.
Okay, Dr. Aish, so if somebody needs to make an appointment with you, Thibodeau, where should they get in contact with you?
I am predominantly based in Thibodeau, but I also do an office in Morgan City, and we are available by phone or internet, and happy to help anyone with the vein disease in the community.
Yeah, absolutely. And I think this is, as you were saying, more and more of a problem that people can take care of themselves, live a longer life. Well, Doctor, I appreciate it.
Thank you for having me.
Thank you so much,
Appreciate your
Dr.
time.
Aish Arora. We'll be right back with more Bayou Time right after this.